wanted to follow up with the video that explained what it was like to have a newborn with Laryngomalacia. So my son now is almost 2 years old, and he still has episodes of choking, but his sleep is much better, and he doesn't choke when he eats. His eating's actually it's excellent. There are a few things that I wish I knew and had to prepare for a baby with a breathing disorder. And one of those things would be to find somebody who would walk through it with me. So sometimes what happens with the doctors is they give you a diagnosis. They might send you for further testing, like a swallow test, and then they kind of just like send you on your way. But you go home with a baby that still can't breathe, and that you're still worried about, and that you still really don't know how to fully manage. So what do you do? And there's a lot of moms that have recommended the Owlette, or it's a pulse oximeter reader, and it will alert you when your baby's oxygen levels drop as they sleep. I would definitely recommend some sort of way to monitor that. Whether it's the Owlette or another pulse ox, I'm not 100% sure on that, because I've seen mixed reviews with the Owlette. But that's all to say something is definitely better than nothing, especially as a very, very sleep deprived mother and worried mom every single night, and every time they nap, and every time they eat. So it can give you some peace of mind, so maybe you could catch a little bit of sleep. Even if it's an hour and a half, it's an hour and a half. So the pulse ox would be important. The other thing I would recommend would be to have a family support system. Truly educating your family on what's going on with your child, and when they're in the hands of somebody else, they know exactly what's going on and what to look for. Also, getting some validation is very freeing for you as a mom, because you do hit a point of sleep deprivation with a baby that has a breathing disorder, where the lines are just very blurred between reality and what you may be making up in your head. And what it comes down to is you're not making any of it up in your head. It's very real. So don't let any doctor, pediatrician, or anybody else tell you otherwise. And that may happen. Another thing I wish I knew was that there may be other tests that can be done besides a swallow test. So I had my son in occupational therapy, and I think that was a saving grace for me. Going to occupational therapy kept me going. It assured me that somebody else was watching my son when it came to things like feeding, and helping him develop properly, where maybe he would not have without that type of support. So that was also very important. Now, sleeping. I see a lot of moms on the support group that talk about sleeping. How is my child supposed to sleep when they can't sleep on their back? So this is a very unique thing with Laryngomalacia babies. They cannot sleep on their back. My son, the first day in the hospital, didn't sleep on his back. I didn't really realize it until we got home, and I was trying very hard to maintain proper sleep patterns and environment with this one, because I kind of didn't do that with the first, and I wanted to set a different tone and have a little more freedom when it came to independence, especially around sleep. So I kept trying to put him on his back. It just wasn't working. You could hear him choking. You could hear the breath just stop, and then the gasp for air. It was very scary, and it would really intensify like once they actually fall asleep and drift off into that deep sleep where everything relaxes. Now you already have it's a lazy larynx, they call it, so you already have floppy tissue there that's not fully developed as it should be. So when they relax more, it causes that choking and inability to breathe. So sleeping, what I did was slept with my son on my chest as I kind of sat upright, not completely upright, but on an angle with a lot of pillows. And then I moved him next to me on pillows that were on an incline. And honestly, that is probably not something I would do again. I would have made it so he had like a wedge to sleep on. I think there's this rocker even that is like kind of like a dome where you can put them on their stomach and they sleep on their stomach, a lot safer than in any other environment. So I would definitely have researched more into other pieces of equipment that could have allowed him to sleep as he needed to. We also did side sleeping. Side sleeping can help. Stomach sleeping just helps so much more, but side sleeping can definitely help. I think it's also important to continue to, again, educate people that are around you, because you don't really want a baby getting a cold or getting sick that's a newborn with a breathing disorder. It can be very scary. They tend to get a lot of phlegm in general, and having a cold just kind of intensifies the breathing issues and the stridor and everything else that goes along with having a Laryngomalacia baby. So I'm just going to touch quickly on like two other points. Nursing. Again, my son choked all of the time when he nursed, and it wasn't because of the letdown. It was because he couldn't get his suck, swallow, breathe down. So cups and spoons, like regular cups, little cups, like a medicine cup with milk, and spoons are a great way to feed babies with this issue. But also, if you're nursing, a side-lying position actually helps a lot. And you kind of get nervous, you think that they might choke a little more, but the side lying gave them more control to take in the milk and swallow it without kind of having gravity push it down their throat. So that's one thing that I see a lot of questions on too, is how to feed. And we were told at the swallow study that a cup or a spoon works well. And actually, like, my son now drinks out of a regular cup, just shy of 2 years old. He prefers it. It gives him a little more control. But again, you could use a little medicine cup to administer the milk, or a spoon. There was one more point that I wanted to touch upon. I can't really remember it right now. Oh, the mucus. These guys get a lot of mucus production, and it's hard to clear. It's hard for them to breathe. So I was steaming my son out. I mean, I would take him into the shower. I would put the eucalyptus oil. I had a diffuser going. We used the nose. I used the, bulb. I tried nose Frida, but it didn't really work. I mean, nothing really worked to clear him out. So my aunt actually gave me a great suggestion, and what she would do with him is, after you steam them, kind of put them on your lap, and you flip the baby, not upside down, just a little bit on an angle down your knee, so they're supported. You're grabbing them by the chin, making sure that they're supported properly, and you kind of just little taps on the back as they're in this very, very not steep downgrade on an angle, and that helps hold the mucus out. That probably was the best way to do it, and it would be even more beneficial after a steam. You don't have to steam them, and you can still get the benefit, but definitely creating that angle downward, allowing the mucus to flow out, and flipping them back over. You don't want to hold them there too long, for sure. But these are just some suggestions that, based off of experience, I would suggest to moms who are also struggling. Definitely get in touch with a support group on Facebook. I don't know if there's any in the area. There's a Laryngomalacia support group that sends out packages too. So if you're in the hospital with your baby a lot, you can get a care package. and it really helps to feel connected and continue just to know that you're not alone. God bless all the moms that deal with this. I was so fortunate to not have my son have to have surgery, so he didn't have severe LM, but it was still a life-changing experience. It was still 10 months of not sleeping, 10 months of worry, 10 months of occupational therapy, 10 months of, you can't relax. And like I said, the level of sleep deprivation, man, there were so many times I really didn't think I was going to make it mentally. I was like, I'm not sure if I'm going to make it through today, because I have another son, so I would have to get up. And no matter how much, so those morning hours are generally the best sleep hours, from 4 or 5 a.m. to 7 or 8 or 9. But when you have another child, you kind of have to get up and face the day. And that was probably that was a very, very challenging time. So for mothers, get yourself some psychological support. Make sure that you have emotional and mental support, preferably in a professional, mental health professional, and friends, and I would say, don't hold it in. Be very candid about what your needs are. And if you need a break, you got to take that break. If you need some extra sleep, you got to get the sleep, even if it's 30 minutes. But I hope this helps somebody out there. Comment below. Comment on YouTube if you have tried. If there are some tried and true ways that worked for you and your child. And I look forward to hearing you. Hang in there, mamas.